Good morning, everybody. Welcome to GoLocal Live. I'm Josh Fenton, CEO and co-founder. With me is Dr. Michael Fine. He is the former director of the Department of Health in Rhode Island. And welcome him to our daily broadcast. A couple items of news before we get started. The governor will be available on live. We'll be streaming the press conference at 1 p.m. And earlier today, we've had a couple pieces of news. One of them is the disturbing job numbers. In the past 2 weeks in Rhode Island, 56,000 have filed for unemployment or temporary disability insurance. Daunting numbers and a huge complexity to our economy. Dr. Fine, let's go right into the numbers. Some good news around the world, but a lot of bad and tough news. And obviously, New York's a big issue.
Sure. Good afternoon. I always like to start with the recovered people. So there are over 100,000 now, 103,000 people listed as recovered. Around the world, we are almost at 400,000 cases. These are positive tests. We assume that the number of actual people with the disease is many times greater than 400,000, but that's the number who have been tested. And about 42,000 of those are new cases, more than we've seen in the last couple of days, but not many as we saw in the middle of last week. So it doesn't look like things are changing that much. In the United States, we are up 11,000 cases to 46,000 positive tests. Again, we never know how much of that is increased testing as opposed to increased disease, because we never get the number of people who are tested and how that changes day by day. In Rhode Island, we're at 106 positive tests or positive cases with 23 new yesterday. We'll hear today's numbers in a little bit from the governor, I think, and 4 people in the hospital. In terms of deaths, around the world, we're at 17,000, up about 1,800. Again, a bump up from the day before, but not as many as, or not as many as happened on a couple of days last week. In the United States, we're at 588 deaths, 129 new deaths. That's also a bump up, but consistent with what we were seeing the week before. I focus most, unfortunately, on the number of deaths. That tells me where we are around the world. And if you listened to the president's news conference yesterday, Dr. Birx, who's leading this effort on the medical side, wisely observed that that's where she's paying most attention, that the mortality is very much in the people over 70 with 3 chronic conditions. That's what we're hearing from around the world. That's good information and doesn't fundamentally change what we understood about things.
Those numbers, obviously, on any given day, there appears to be good news and some bad news around the globe. Let's go to New York. I think the numbers out of New York, Governor Cuomo was on just a few minutes ago, are concerning. The rate of the growth, the number of cases. They are testing a lot in New York. They are, I think, the highest percentage of tests have been implemented there. But the factuality of being so densely populated, especially in the 5 boroughs, is having an effect. As a state, Rhode Island is second only to New Jersey. Is there learning from there, and should there be concerns because of those numbers in New York?
Well, I think there should be concerns, particularly in our more densely populated cities. It is really hard for people to isolate themselves, to create a hibernation room, as I've called it, when there are lots of people living together in a small apartment. And so this is an issue of real concern. I've been working very closely with the mayors of Pawtucket and Central Falls, trying to make sure we get the word out about how people should take care of themselves, how and when they should isolate, all the things that we're asking everyone else to do. We really need to make clear in those very densely populated communities.
In Rhode Island, we saw the first significant jump up with 23 new cases yesterday. Do you expect the same type of growth, or will we start to see more significant increases as the virus has matured in the community?
I just don't know. I think some of the jump up we saw yesterday may have been the effect of how reporting happens over the weekend. We'll see today and tomorrow and the next day. Obviously, we have had time for the virus to spread, which favors more cases. But then we've also, in the last week, worked hard on social distancing, which may help contain those cases. One of the interesting things to me about Rhode Island is not just the number of cases, but where those cases are occurring. Noticing that most of the cases are in Providence County, in the more densely populated places, and that's a trend I expect to continue. I am hoping that before long, when the number of cases gets above a certain threshold, that the Department of Health will start telling us how many cases there are in each city, because I think that seeing those numbers close up and personal will really help people get going in terms of their own communities and really work extra hard on social distancing and similar sorts of things.
About 60%, I think roughly, are in Providence County, but about 64% of the state's population is in Providence County. Does it matter so much in Rhode Island, where we're not even a borough of New York?
Well, it probably matters about disease transmission. So in the less densely populated places, if we see that we don't see as much disease transmission, we can be thoughtful and judicious about the kind of resources we bring to the table. But conversely, if we see disease transmission in more densely populated places, then we're going to have to roll up our sleeves and work harder. Remember, those more densely populated places are places where people don't always speak English as a first language, and where we see more folks who are homeless. And those, to me, look like the populations that are likely to be at greatest risk. I'm particularly worried about the homeless population.
Let's talk about the homeless. Yeah, let's go there. In some places, I believe New York City has rented tens of thousands, maybe hundreds of thousands of hotel rooms to put the homeless in a more isolated, separated situation. Should we be doing the same here in Rhode Island?
I think so. We have between 5,000 and 10,000 hotel rooms in Rhode Island, and over the course of a year, about 4,000 people who are homeless. I think it's a wonderful opportunity to get people in situations where they isolate themselves and stay stronger. The other concern I have about the homeless is not just the risk of disease transmission, which I think is real because people are packed together in congregate settings at night and for meals. The other concern I have is the phenomena called weathering, where people who have lived on the street actually are physiologically older, more tired, and are, in my view, likely to get sicker and end up in the intensive care unit much more frequently than anybody else. That's why I think we need special attention to this population.
So that 50-year-old homeless individual may actually be much more like a 70-year-old.
Exactly. Physiologically more like 70 and less able to tolerate the effects of the virus. I mean, what we're learning about this virus is that for most people, it is asymptomatic or benign. But for the people with multiple medical problems, whose physiology isn't strong, that's who this virus ravages, and that's who this virus kills.
Dr. Fine, what's the biggest panic button right now in your mind? What should Rhode Island's infrastructure, government, and healthcare be focused on as the number one priority before this wave hits us, as it has in other places? New York City right now, Louisiana, the cases are growing by leaps and bounds.
Well, I've said before and I'll say again, there's no reason for panic. There's nothing to fear but fear itself. We need to be focused and calm and work together. And for me, I'll repeat what I said yesterday, I think our battle rhythm needs to be developing opportunities for testing enough people, finding everyone who's positive, and getting everyone who's positive into an isolation setting as we are developing the capacity for more ventilators and more ICU beds. The more ventilators and ICU beds are probably, the need for that is probably 3, 4, 5 weeks down the line. But isolation, if we could get it up and running soon, that's going to serve us now and help us reduce the number of people who are going to need the ICU all at once. Remember, we're essentially all getting this virus. And for most of us, it will be reasonably benign. But the challenge is to spread that process of getting it out over time so we can deal with the needs of people as they get sick.
The president at his press conference, and this now we start to see the yin and yang of the national debate of healthcare versus the economy. The president saying, hey, listen, we can't bankrupt the country. We can't destroy our economy in order to completely shut down our entire country's economy for months and months at a time. You're a public health expert, but you've also always been a pragmatic person. The long-term implications of a destroyed economy or a greatly damaged economy would also have health and economic impacts for years, if not decades. What's the implication of this discussion right now? How do we meld these two things together?
Well, I think the way we meld these things together is good, careful public health work and relying on the evidence. So we need to do some of the things we've been talking about here, paying really careful attention to how many people we're testing, what % of those tests are positive. We need to pay careful attention to what the hospital and ICU capacity is, and do what we in medicine call titrate. That is, as we damp this down, open things up a little bit, try to get the economy moving where we can. But if we see this kind of sputtering outbreak that I think some of us expect, then we may have to clamp down again in specific places and with specific populations in order to control the total number of people who get sick until either almost everybody has had the disease and is immune, or until we get a vaccine.
In order for people to plan, I think there's been a lot of discussion about what happens in the next 6, 8, 10 weeks. I think everyone obviously is hopeful. You're getting that some normalcy will revert back in the summer months. Wuhan has turned on their public transportation system. Almost shocking that after just 4 months of this virus that they've already progressed to that point. But also, whatever we do now to limit exposure, should we plan for a fall reoccurrence?
I don't know if expect is the right word, but in my world we have a very famous saying that is chance favors the prepared mind. So could we have a recurrence? We might. But by the time fall comes around, I greatly hope we'll have the isolation hospitals and the ICU capacity we need, so that should there be another increase in the number of cases, we can do what we need to do, and we have the capacity to manage it and manage it with sophistication. That's what we're lacking right at this moment, and that's what I know everybody's working hard on building up.
Anything else folks should know?
I think that's most of it. This is a great time to quit smoking. I know this makes a lot of people anxious, and anxiety promotes or encourages people to smoke. But people who are smokers, by definition, all have chronic obstructive lung disease. And chronic obstructive lung disease is something that puts people at risk for needing the hospital or the ICU. So this is the time to put them away, to figure out something else to do. And this is the time to be really careful to wash your hands multiple times a day and to isolate the moment you get sick.
There is that unintended consequence of people going out and walking more to relieve the stress, to deal with boredom of being at home all the time, to escape screaming children, and also not eating out as much, obviously, so that potentially their diet is better. Are those potential wins out of this?
Absolutely. I mean, exercise of any sort helps, release endorphins, and endorphins help people relax and calm down. So exercise by itself is an excellent anti-anxiety approach. It has many cardiovascular benefits, and if it helps relieve people's anxiety, then maybe they can help smoke. That will help them quit smoking. So, from that perspective, we may get a healthier population long run, once we get past this difficult period.
As always, Dr. Michael Fine, thank you very much. Stay tuned, everyone, for Governor Gina Raimondo. That will be streamed live on GoLocal at 1 o'clock. Later this afternoon, we'll be chatting with Jennifer Lawless, political science professor at the University of Virginia, and she'll be talking about what the implications are on this relative to American politics, Congress, the United States Senate, and potentially on the election in November. Thank you, everybody, for tuning in. We'll see you back here at GoLocal at 1 o'clock, streaming the governor. Thank you.
Thanks, Josh.